Good morning. I'm here at the Medical Towers of Tuscan Courts in Magee. And you know, you probably passed by this building so many times, and you might even have been in this building so many times and looked at these big walls. But you know what? You might be missing the jewel that's right in the middle of our medical towers. These ladies and gentlemen are with me today because we're going to discuss another service that is available through our clinics. I don't know if you come to Magee, but you need to be. And these are going to show you some of the reasons why. I'm going to let them introduce themselves, and then I'm going to ask them questions.
My name is Martha Smith. I'm a family nurse practitioner at Tuscan Courts.
Hi, my name is Deborah Devlin. I'm a nurse practitioner as well with the Medical Pavilion in Raleigh.
And I'm Donna Balcom, a family nurse practitioner at Harvard Clinic in Taylorsville.
I'm David Johnson. I'm a certified physician assistant here at Tuscan Courts. I also do shifts in the after-hours clinic. So I do family practice and urgent care.
So y'all are working all the time. In other words, all the time. Okay, girls, I just want to know, what actually is a nurse practitioner? We'll start with you, Miss Martha.
A nurse practitioner is a primary care provider that we offer primary care services to patients of all ages. We can write prescriptions, we can order tests, we can evaluate the test results and treat the patients. We work in collaboration with the physician.
Donna, do you find that you have patients of a certain age?
I see all ages from newborns to late in life, and probably see more adult patients than I do pediatrics, but I do see pediatrics and enjoy seeing pediatrics.
I would think so.
Yeah,
That would be
they're
fun.
fun.
I don't know if they're crying babies. I don't know if they'd be fun or not. I can't say that for sure. Deborah, this is kind of a loaded question, so I'm picking on you. But what is the difference in a nurse, an RN, and a nurse practitioner?
A nurse practitioner has a more advanced education. We, as registered nurses, typically go towards BSN or master's degree, but as an advanced practice nurse, we have a postgraduate degree in primary care and more of your advanced care patient needs.
Okay. Well, Dave, you know, I've known you've been with us for a while here in Magee, so just like Martha, you're a familiar face. But what is a physician's assistant? What's the difference between?
Well, when you get down to it, there's not much difference. We're both mid-level practitioners. The training's a little different. The ladies come up through the nursing ranks as RNs with a lot of experience taking care of patients, and then they go on and get advanced degrees. PAs, we typically go through PA school. It's a graduate program, a master's program. After most people like myself have had bachelor's of science, but there are a lot of different backgrounds. The PA field's a little bit newer than the physician or the nurse practitioner field. Your first PAs were in the military in the 1970s. They were corpsmen and medics in Vietnam. The first class was at Duke University in North Carolina. I want to say 70, 72 is the first class that graduated there. So it was basically taking these guys who had worked as nurses themselves and with all this experience taking care of patients and giving them advanced training, kind of like nurse practitioners, to put them in clinic settings to better take care of patients, to treat patients, order tests, diagnose. Pretty much everything a nurse practitioner does.
I was going to say, basically, it's the same thing, but you went a different path. You went a different path.
I always tell people we're all mid-levels as part of the team.
Well, you know, when you use the term mid-level, and I saw this frequently when I was doing some research on it, and I thought, you know, if someone read the term mid-level, would you even understand what it's talking about? Go with that a little more, because when we say y'all are mid-level.
I think that's a term that was coined pretty much by ourselves because we're between a nurse and a doctor, but actually closer to a doctor, because honestly, I've had patients call me doc, and I know these ladies have as well, because they, and pretty much because they're happy with the care that they get. We try to do our best. You know, we sometimes have maybe a little more time luxury than physicians have, and I've always heard that that's one thing, a benefit, that we can explain things a little better. We do sometimes have that luxury to spend more time with the patient, and that's always well appreciated by patients. And I think that's one of the most attractive things to this field, the reason a lot of us go into it.
I would think so, because, you know, being able to actually interact with your patients, because it's becoming so much more difficult for doctors to have any time with them, and it's not something they want, it's just the way it's all falling together. Can you write prescriptions?
We can. We can write prescriptions for medications, for other services for patients, physical therapy. We can order physical therapy. We can order, you know, other tests at the hospital.
Okay, this might be a better question. What can't you do? Would y'all say? I'm sure you do it all, so you can't figure out anything you can't do. But I mean, you know, really, what can you not do?
Well, under the protocols of our profession, there really is very, very little that's limited as to what we can do. Really can't even be specific as to what we can't do. If we're trained and it falls under our protocols, we can do anything that would supply the needs of a patient. And what we can't particularly do, then we are, one other thing that seems to be common among us as, quote, mid-levels, is that we don't mind referring to specialists when there's a need for that as well. You know, there's certainly, as primary care, we take care of the primary care needs of patients, but you have those that require orthopedics and neurology and all other different kinds of specialties, and we have the ability to refer as we need to for what we can't actually handle right there in our clinic.
So you can take care. You can take care of anything all the way. How does this affect the cost? How does this, because cost is such a factor in everything we do. Whatever, our clinics, the hospital, the doctors, and also as a consumer. What does this do? Can you take my insurance?
Yes, we can take most insurances. It's just like a physician, you have to get approved through that insurance. And then once you are, you're ready to go, just like the physician is.
So really, it's almost training our mind to think differently, because, you know, we just think we have to go to the doctor word, whereas really what you're giving is something I think so many people desire, is that closeness, or that feeling that you can have time to talk and be with them. And anybody can see a nurse practitioner, right? Or a physical assistant. If I leave you out, physician assistant, I don't mean to. Anybody can see y'all, is what I'm trying to say.
Sure.
It's not something that is just limited to whatever.
And I appreciate the fact that you've allowed us to come and to say these things, because I still am a little bit amused at the fact that a patient would say they would, you know, wish they could see a doctor, and they really don't understand what a nurse practitioner does do, and the fact that, you know, we take care of all their needs just like a doctor, and sometimes it's hard for them to change that mindset to realize that we do all the same things.
Oh, well, I agree with you. I think that's the key.
I'd like to add something.
Yes,
to
ma'am.
what she was saying. I was talking to a physician recently, and he said that he thinks that most nurses go on to get their advanced practice because they enjoy the contact that they have with the patients, and that they sometimes spend a lot more time with the patient, and they take good care of them. And so that comes from a physician that I work with.
That's interesting. That's interesting. And I'm sure that's true, because I think when you say more time, that's money to some. I mean, that's wonderful. That's wonderful. That's a great thing. I hope that you will visit any of our nurse practitioners or physician assistants here at either the Taylorsville or Raleigh clinic, or right here at Magee, because I think you know from what we've said, and I'm just saying, they can do it all. So take advantage of it. Get that one-on-one that maybe you've been looking for, that you feel like you haven't had in another area. It's right before you, and all you've got to do is reach out. You can call their offices. You can call the clinic here at Magee. They'll direct you to any of them, and we'll have the information also on the website. I hope y'all have a great day, and if y'all have anything else you would like to contribute or say, I'll tell y'all this, I'm quite impressed with this group and all that they do, and that they're running up and down and trying to keep everybody happy. So you may see them here at the clinic, you may see them at after hours, you may see them at the hospital. But let me tell you this, they can take care of you.